Welcome everybody. We're just letting in people, and while we do that, just give them a minute to come in. Great. So still a few more people just joining us. And a big welcome to everybody who is here already. Okay, let's get going because we've got an hour to do this meeting and lots to cover. So welcome everyone. My name is Vic Rayner. I am the chair of this session and I'm a member of the Care Provider Alliance, and my day job is running the National Care Forum, which is a membership body for not-for-profit care providers, care and support providers. So today we are going to have a webinar on the Fair Pay Agreement, and we're doing this from the perspective of the Care Provider Alliance. So we're also going to tell you a little bit about what the Care Provider Alliance has been doing in relation to this, and also we're hearing today from Department of Health colleagues about what's been happening with the Adult Social Care Fair Pay Agreement. We'll have a good chunk of time for questions, and then we'll do a little wrap up at the end. But before I go any further, there's a couple of things that I need to mention. Firstly, to say that we're recording the session. So there will be a recording available. I think, Rachel, if we're getting AI tools in there, we'll probably remove those because we are taking a recording of the session and we will be sending out slides and links. So if we can remove any AI that's in the call, that would be helpful. We are everybody's come in with their sound and camera off. You're welcome to turn your camera on if you would like to, but there's no need to do that. And similarly, if you could keep your sound off just to minimize any disruption, that would be very helpful. We've got a Q&A function. You'll be able to see, if you're familiar with Teams, up on the top row, a Q&A specific button. If you can use that to put any questions in, that would be really helpful. We will be keeping an eye on the chat as well. But if we can keep them mainly in the Q&A, that would streamline it a little bit for us. We're going to share with everybody who has signed up for this webinar a copy of the recording, the slides, and any relevant links that are posted in the chat. And if you know of something that would be helpful for other people to see, then do please include that there as well. And that will go out to people. It will also then be hosted on the CPA website later on over the coming days. So yes, that's probably all the kind of introduction things. What I'm going to do quickly then is just give you a little bit of a download on what the CPA has been doing. So the CPA is the Care Provider Alliance. That is an alliance of the 10 trade bodies that are shown up here on the screen. Hopefully many of you are members of one of these or maybe some of these. These 10 organisations work together across a whole range of issues. And between us, we think we have reach into about 95% of care providers across the sector. And in the context of this conversation, clearly that then translates into employers. So we see this as a hugely important area, the Fair Pay Agreement, as something that's very significant for the sector. We're going to hear about what the government's thinking about it is and your questions about it are. But over the last year, we have been working hard on your behalf to think about some of the kind of core issues that are coming up and we anticipate being on the agenda. And as with lots of policy work, a lot of what we see is not very well, a lot of what we do is not particularly visible, but hopefully it's visible in the context of some of the things that are now appearing in the consultation and others we have been able to influence and to give advice and counsel and direction around. within the confines of the kind of pre-consultation period. So most of the work that we've been doing has been in that pre-consultation period. So we engaged on a regular basis with what's been called the Fair Pay Agreement Working Group, which is government convened. It's a cross sectoral group in the sense that it brings together a lot of the parties who are engaged, so local government, unions, providers / employers in that context, as well as some sector specialist organisations such as Skills for Care, and includes local government and health, NHS employers and others. So that meets on a quarterly basis, and we've had a good level of CPA representation in those meetings. There have also been a dozen topic-specific Fair Pay Agreement task and finish subgroups, which have covered a whole host of different areas, many of which are now appearing in the consultation. So things around what the negotiating body should look like, things around all sorts of what should be included in the negotiations, and a whole host of other areas. And those task and finish groups are continuing around sort of core issues like recruitment of the chair, etc., etc. So they have been convened by the government, and CPA colleagues have been attending those on behalf of the sector, and what they have also and those have met multiple times on different occasions. So there's been lots of engagement in that. We have been working on collaborative policy positions, and all of us have been engaging with our individual members and bringing back together the sort of the kind of combined wisdom from those discussion groups, and raising perspectives of individual individual areas. We're very aware that the way in which a fair pay agreement lands may feel very different depending on which parts of the sector you're in and possibly which parts of the country you're in. So we've been trying to reflect and galvanise all those positions. Lots of broadcast information, etc., including today's webinars, and other things that we've been doing around both this and the Employment Rights Bill. If you go and have a look on the website, and I'm sure Rachel's going to put it in the chat, we've got some FAQ documents, briefings, press releases. We've got a community of practice that we would love you to get much more involved in as well. And we've been trying to work through some of the kind of complexities in order to get to a place where collectively there is a set of positions around the overall questions raised within the consultation. So lots of work has been going on behind the scenes, and we're now in a chance where we've moved on from the pre-consultation period to the consultation, which opened in at the very end of September this year, and runs until January the 16th. In its substantive form, and with an easy read extension to that I'm sure Kate and Claire will cover in their presentation. So we're now in the point of the consultation. Things that you can bring up here will be hugely helpful, so do put questions into the chat. We really want to make sure we've got all the perspectives raised. Any questions that are put there will be downloaded, and if they're not answered today, we will make sure that the department has those, and we will try our best to reply to those. All the members of the CPA would want to hear directly from you as well, so please do make sure that this, if you haven't raised your voice around some of these areas before, that this is a catalyst for that, and share as much as you can. So with that, I will pass on to Claire Lucas and Kate Shires, who are here from the Department of Health and Social Care and have been very strongly involved in all of this policy development area, and are going to give us a little bit of a rundown on where we are at the moment. So over to you, Kate and Claire. Thank you.
Thank you, Vic. That's teed us up perfectly. Thank you so much. So hi, everyone. My name's Kate Shires. I am one of the policy leads in the Department of Health and Social Care, working on this fair pay agreement. I'm also joined today by my colleague, Claire. Claire, do you want to introduce yourself?
Yep, absolutely. Thanks, Kate. So my name is Claire Lucas. I also work in the Fair Pay Agreement team alongside Kate, and I lead on our stakeholder engagement. So great to be here today.
I mean, thank you so much to Vic and everybody at the Care Provider Alliance, firstly for all of the incredibly hard work they've been doing to engage with us, as Vic has just set out, but also for helping us get the word out about our work and inviting us along to sessions like this today. Really, really do appreciate it. So we have got a short presentation to kick us off. I'm going to talk about a little bit of the background to the Fair Pay Agreement. So I'll set out some information about what it is, why we're doing it, and talk a little bit about some of the timelines and the funding. And then Claire is going to talk about the consultation that we launched in September and set out some of the things that are in that and that we would really love to get your views on. And we'll talk about how you can get involved. And then we'll leave hopefully lots of time for a really rich discussion. As this work is still in the policy development phase, no final decisions have been made, so plenty of opportunity for you to influence the design of this and help us get it right. So I'd really echo what Vic said, like please do put as many questions, comments, thoughts as you want in the chat. We have been doing the engagement that Vic outlined already through our working group and some task and finish groups, but the point we're at now means that we want to go much broader with this and hear from as many people as possible, because we really believe the only way to make good policy that actually is going to work for everybody is to talk to as many people as possible. So we really do value any thoughts and questions that you've got. So what is a fair pay agreement, I hear you ask? The Fair Pay Agreement will set the minimum pay and other terms and conditions for workers in adult social care. It'll be agreed through introducing a new form of collective bargaining to the adult social care sector. So to do that, we will set up a new adult social care negotiating body, and that will bring together people who represent employers, people who represent the workers, and potentially others. And they'll get together to negotiate a new standardised set of pay and terms and conditions, and potentially also look at other things around training and career progression. Our intention is that that will be negotiated on a regular basis, probably annual is what we're suggesting in our consultation. So what we're looking at here is hopefully a bit of a journey of transformation for the sector with somewhere to build on every year. The final result of those negotiations will become the law. So it will go through Parliament and then it will apply to the contracts of all the workers in scope, and then it will be enforceable by law. So in a similar way to HMRC currently enforcing the national minimum wage, whatever this body agrees, workers will have to be paid. This Fair Pay Agreement is also going to be complemented by some new rights for trade unions to access the workplace. This is work being led by our colleagues at the Department of Business and Trade. They've got a consultation open on that at the minute. That closes on the 18th of December, which I recognise is not a particularly sociable deadline with everything else that you will all have to contend with in December, but just to flag there are opportunities to influence that work as well. And that's all about ensuring that trade unions, when they are approaching workplaces, are doing it in a responsible, organised manner. The benefit of that would be to improve representation of the workforce, and there are conversations we'll be having with the Care Provider Alliance and others around how we get that right and sort of manage any concerns and pressures for businesses. In terms of why we're doing this, you will all know, you're not going to need me to tell you, that the 1.5 million people working in social care are providing really essential care and support every day to people of all different needs. But we know that the sector is facing some really significant workforce challenges, and we know that adult social care workers are often paid at or around the living wage, and that's going to be contributing to some of those problems. So what we really want to do is try and tackle this recruitment and retention crisis, in turn improving the quality of care that people are receiving. And in the process, hopefully improving working conditions and raising living standards for care workers by putting more money into their pockets. I'm going to talk a little bit about some of the timelines that underpin this to bring it to life for you. So the Fair Pay Agreement is being put into law by the Employment Rights Bill. That was introduced into Parliament in October last year. It's currently working its way through all the parliamentary stages. It's in the last few phases, so we expect it to achieve royal assent and become the law, hopefully by the end of this year, if not very, very early next year. So that bill covers a whole load of things that apply to all sectors of the economy, including social care. Some changes coming to statutory sick pay, to 0 hours contracts, which are not a ban on 0 hours contracts, but workers will have to be offered guaranteed hours. They can choose to reject them, but they will have to be offered them, which is a bit of a change. So that bill also gives us the framework to establish a fair pay agreement in adult social care. It essentially gives the department a really broad framework to work within. The work that Claire and I and our team have been doing with the sector for the last 15 months or so is then taking that and looking at what all of the detail underneath that looks like. What does the whole process look like and how do we make this work? So where we are now is that we've developed some options for how we think it could work. That's gone into our consultation, which launched at the end of September. As Vic said, it's open until the 16th of January, and we also have an easy read, accessible version that's open until the 6th of March. When the consultation closes, Claire and I and all of our team will sit down and read every single response, and we'll use that to inform the final policy design. So we expect to have gone through all of that process and then laid some secondary legislation to put this into law by next autumn. We then have to set up the body that's actually going to do this, and we expect them to start negotiations in 2027 and also conclude the negotiations in the same year. We'll then need to leave some time for government to do the processy bits, that's the technical term, put it through law and ratify that, and we'll need to make sure that we're leaving time for the sector to be able to understand the outcome of those negotiations, for employers to understand what that means for them and any changes they need to make to how they're operating, for commissioners and other parts of the system to understand what they need to do, and for employees to understand their new rights. We are expecting the first ever fair pay agreement to come into effect on the 1st of April 2028. So that would be the date at which whatever the body has agreed would start to apply to workers' contracts. So one thing we're thinking about quite carefully now is, although that looks like quite a long time away, how can we make sure we're thinking now about how implementation will work on the ground? What kind of support is the sector going to need to be able to get this right? We've got some questions in our consultation about this, but we'd also really welcome views on that in this discussion today. So are we leaving enough time in the negotiation process that we're talking about for businesses to understand what they need to do and be able to implement that, for example? We're also really conscious that there are lots of changes coming through the Employment Rights Bill. So hopefully a phased approach to implementation will try and balance what we recognise is a really big, meaningful reform for a complex, diverse sector with the other changes that are coming down the track. I'm going to move on to talk about funding, because I appreciate that is always top of minds, and rightly so. So as a majority of adult social care provision is funded by the state through councils and through the NHS, government's been really clear that it will financially contribute to the fair pay agreement. The spending review earlier this year allows for an increase of over £4 billion of funding available for adult social care in 2028-29 compared to where we are today. So that's the money for all adult social care in that year. Within that £4 billion, £500 million has been earmarked for improving pay and terms and conditions through that first fair pay agreement. So that's just the first one. Every year after that, we'll have to go through the spending review process to understand how much money we can have in future years. So £500 million is the start. That money will then be paid to councils to reflect the increased cost of care. One of the things we're thinking about quite carefully at the minute is how we balance this need for greater pay for the workforce with the potential cost to the taxpayers, and how we make sure that we are not seeing a situation where the negotiating body gets together, spends a lot of their really hard-earned time coming up with something that actually isn't affordable, because that's not what we want to see. So we are suggesting in our consultation that the negotiating body is given an envelope at the beginning, and it is told, for example, in that first year, you have a maximum of £500 million. Please go away and negotiate and decide how best to spend that. So hopefully that will make sure that whatever agreement the body comes to is affordable, because they've stayed within that envelope. And Secretary of State will have a role in the process to check affordability for the sector as well. I am going to hand over to Claire, who is going to talk to us a little bit more about the consultation. So Claire.
Thanks, Kate. So as Vic set out at the beginning of today's session, we know how important it is that we're collaborating with the sector in the development of this policy. It's a brand new policy coming into adult social care, and we want to make sure we're setting it up right from the start and talking to the people that know the sector best. So since the Employment Rights Bill was introduced in autumn 2024, we've been engaging with sector partners to develop our initial policy thinking. So we have our FPA working group. So this brings together various stakeholders from across the sector. So trade unions, employer reps, such as the CPA and some of the member organisations, local government and other sector representatives to discuss the policy ideas and also to inform our task and finish groups. So these are more policy specific groups, which have a broader attendance of people than just the working group. And it's given us a chance to look at some of the different policy issues in a lot more detail. So discussing things like who could be covered by an FPA and how negotiations could work. Alongside this, we've also been doing a lot of ad hoc engagement with the sector, so trying to run webinars like this, information sessions to try and raise awareness of what the FPA is, what we're looking at and what our thinking is. And all of this has helped inform where we got to launch the public consultation. So the consultation is really our moment to test this policy thinking with a broader audience, to make sure that we're setting it up to work in practice and be successful within the sector. So the consultation is open for anyone with an interest in social care to respond to, and a chance for people to share their views on the design of the fair pay agreement process. And it's an important distinction to make that this consultation is looking at the process by which an FPA would be agreed, as opposed to the outcome of the fair pay agreement, because that will be subject to the negotiation process. So that's not something that's currently covered within it. Can we go to the next slide, please, Kate? Thank you. So in terms of the consultation document itself, it is very long, I will be honest. And so this gives a bit of a summary of the different sections that are covered within it. So we have some introductory sections which set out all the information that Kate has just run through in terms of the background to the policy, what the consultation is looking at and why, but also give some details around funding and implementation timelines. We then get into the detail of our proposals around the process by which a fair pay agreement would be reached. So we have a section that looks at the new adult social care negotiating body that we're looking to set up. So this covers who could be involved in those negotiations. So there are proposals around who could represent workers and who could represent employers, and also any other members that should be considered for that body. And it also talks about the support that should be available for the body. So having a chair and a secretariat and how that could function practically. So there's some quite specific questions in there, but also some open questions to get people's thoughts and feedback. We then move on to look at the negotiating process. So this looks at the timelines and frequency of negotiations, and again, seeking people's views about, are we allowing enough time? Are there other considerations we should think of through this process? We then have a section that looks at coverage and remit. So this is essentially looking at who and what should be in scope of FPAs. And we're seeking views on different areas here. So looking at pay, but also terms and conditions and wider employment policies, such as learning and development. We also look at who the body could cover, including the type of job roles, services and settings. So there is a lot of detail in this section, and really a key area where we're seeking views about, are there things that we haven't considered and practicalities we should be aware of, but also any suggestions about particular areas of terms and conditions and wider employment policies that the sector think we should focus on or prioritise. We then move on to a section that looks at dispute resolution. So this is what happens if a decision cannot be reached by the body and how disputes should be resolved. So it's all focused on how we can support the negotiating body to successfully reach an agreement and get that agreement for the sector. We then look at implementation. As Kate touched on, we're very aware that this is a brand new policy and going into a large and complicated sector. So we want to make sure that the right support is there to support the implementation and rollout of the FPA. So it looks at what preparation for implementation might be needed and what we can do as government to support the sector to get ready and be aware of what is needed. We then talk about compliance and enforcement. So this is looking at the support the sector would need to comply with an FPA. So there is mention of the types of guidance or codes of practice that might be needed, and seeking people's views about how best to approach this. For example, is anything more targeted needed for smaller providers versus larger providers? So another area where we're really keen to get people's views. And we also look at what enforcement regimes might be required for the FPA. So all focused on making sure that once we have an agreement, it does apply to workers and workers manage to benefit from the pay and terms and conditions that are introduced. We then finally have some closing sections where we ask some questions about equality's impact. We also have a glossary of key terms because we're aware we've thrown a lot of new terms into the consultation document, and it's always helpful to define what these actually mean. And we have details of how to respond to the consultation. And so just to say on that last point, alongside the consultation document, we have an online survey that people can complete. You can start that survey and come back to it. So it gives you a link that you can come back to if you don't want to do it all in one sitting. It's also worth flagging that based on the questions you answer at the beginning about what capacity you're responding in, so if you're responding in a personal or professional capacity, for example, you will get shown the most relevant questions to you, and you're also able to skip questions. And if you don't want to give open responses, you don't have to. So it's all aimed at trying to make it as smooth as possible for people to engage with. So hopefully that makes it a little easier for people to use. And also to flag with that the consultation questions are included in the consultation document. So if you want to look at the questions in advance of completing the survey, that can sometimes be helpful to just understand what questions might be asked. Next slide, please, Kate. Thank you. So we're very aware that putting a long document on gov.uk is not the only way we should be engaging with the sector and hearing people's views. So it's exactly why we're running engagement sessions like this during the consultation period, as a chance to talk to the sector directly, hear your views, hear your concerns and questions. So we are setting up events ourselves. So we've been having various discussions, running various teach-ins and webinars, trying to go on visits, all opportunities to get out and talk to the sector. We're also attending sector events like this one, and we've been so grateful to all our partners in the sector that have been setting up sessions and giving us a chance to talk to as many people as possible. And all of this links to the importance of information sharing, because we're aware we've got a huge and diverse sector to reach, and the best way to do that is to share information and spread that out as far and wide as possible. So we're really encouraging people, when you attend a session, do go away and talk to others that you think might have an interest in the consultation and let them know it's happening. We have a video that we will hopefully be able to post in the chat, which gives a nice, helpful introduction to the policy and the consultation as a way to just inform people about what this is and why it's so important to engage. And we're really keen to just get the message about the consultation out in newsletters, on social media, any avenue we can. And as Vic set out earlier, CPA have been incredibly supportive in that front, and we're very grateful for all your help. We have our email address on this slide, and I've seen that Rachel's put it in the chat as well. But do get in touch with us if there are other sessions you think we should be coming to. As Kate mentioned, our Easy Read consultation is open until March. So we're looking in the new year to try and do more sessions targeted at people that might be responding through that route, as a chance to do slightly different engagement and more targeted. So if you're aware of a group or a part of a group that you think we should come to, please do send us an email, and we'd really be keen to set something up with you. Next slide, please, Kate. Thank you. So why your response is important to us and how to get involved. So the consultation is a crucial step in the design of the policy, but we know we need to hear from you and the wider sector to make it workable and make sure it can have the positive impact that we want it to have. So the key thing is that we're asking people to engage with the consultation. So attending engagement events like this one is a huge part of that, but also reading the consultation document and responding to the survey. It's such a key thing for us to really hear the range of views that we need to hear to inform the next steps of where we go with the policy. We're also asking people to share information for us. So as I said, if you have colleagues, friends, family that you think should be responding to this consultation, please tell them about it. Please share information with them. It's the best way for us to reach as many people as possible that should be responding to the consultation. So do spread the word far and wide. We're also asking you to invite us to events, meetings, tell us if there's something happening that you think we should be at. As I say, in the new year, we're really going to be looking at how we can reach more people who draw on care and support, but also unpaid carers, for example. So trying to go broader with our engagement and be a bit more targeted whilst we've got that easy read consultation open. And then finally, we want you to tell us what you're hearing. So giving us feedback about the consultation, about the policy, about our engagement, it all helps us to improve our approach and make sure we're doing this in the best way possible, which is exactly what we're here today to do. So thank you. And I think we've got a next slide to hand back to Vic.
Brilliant. All right, look, great. Thank you very much, both of you. And I suggest, Kate, if you don't mind, we'll just take down the slides rather than look at that. And thank you, everybody who has been putting lots of questions in the chat. So I'm going to have a go at seeing if I can wrap some of those up together a little bit, and there's some that I think are fairly quick wins in the context of clarification, but always useful for you to think about whether that ambiguity is out there more broadly. So there was a question about so fair pay agreement applies just to social care. How's it going to improve recruitment if other sectors also get the same FPA? So I think that's the kind of scope question. Do you want to, I mean, I think that's fairly straightforward to clarify, but do you want to give that a go?
Yep, absolutely. So this fair pay agreement is just being proposed for adult social care. This is the first sector to get this. The government has indicated that if this works well, they might like to roll it out to other sectors in future, but at the moment we adult social care are the only sector getting a fair pay agreement. So hopefully that clarifies that. Vic, I saw another question about under 18s, which is similar, isn't it? So it's not going to apply to children's social care. It will just be applying to adult social care. Claire and I have got contacts into our children's social care policy colleagues at the Department for Education, who I'm sure will be really keen to learn from us, and we've been talking to them, but at the moment just talking about adult social care.
And another scope one is UK wide or just England, and I think the legislation and scope gives some slightly different kind of context. So
yeah, it's a good question. So this is a tension between employment rights applying to all of the UK, but health being Department of Health and Social Care being England. So the Employment Rights Bill gives England and Scotland and Wales the powers to have their own fair pay agreement. Everybody will be taking that forward separately. So the work that Claire and I are talking about now is just about England, but Wales and Scotland have got the powers to create their own fair pay agreements, and we're talking to Wales and Scotland about what that looks like, particularly for people who operate at the borders, what we sort of call cross-border workers and businesses who operate at the border. And there are some questions in our consultation where we ask about that. So if that concerns anybody or is applicable to anybody, really open to feedback on that.
Great, but just to be clear, really, Scotland and Wales have not been actively involved in any of those working group discussions, task and finish groups particularly. So what you've described in what the consultation is asking about is people's perspective on England.
Yes,
only.
So
okay.
The consultation is specifically focused on England. Yeah.
Okay, that's useful to know. And just another sort of scope question about who's in scope. So there's a question about roles, which is Damien's question: how many of the roles are considered direct care versus administrative management or ancillary services? And does the 500 million apply to all workers or only certain categories? I suspect this might be the first time you'll say it, but won't be the last time, about what the process of negotiation might lead us to. But you might want to start with what the overarching legislation allows for.
Yeah, thank you, Vic. That's a really important question. So you are going to find in this session that a lot of our answers are slightly, it depends, but the Employment Rights Bill sets a really broad definition for what adult social care is. And it basically says adult social care is anybody who spends all or most of their time at work working in adult social care. So that would therefore cover pretty much all the roles we're talking about there. What we can do is we can leave it like that, and then the negotiating body every year when it gets together can decide that it would like to focus on this role this year or this role that year. We can also take some decisions now to take certain groups out of scope. So in our consultation, we ask some questions about that. I think it will be fair to say through some of the conversations that we've had in the working groups that there seems to be a feeling that perhaps what the negotiating body should be left to play with as much of that as possible, because the negotiating body has been brought together as a group of experts who really know the sector and who know how that money should best be spent. It perhaps follows that they might be best placed to decide which roles to look at each year, but that is covered in our consultation. So quite broad at the minute, could narrow down ultimately down to the negotiating body.
Yeah, and I think Val's put a point in about this distinction between children's and adult services, and that sort of unhelpful set of differentials that might appear between those. And I know certainly in our membership, there's lots of organisations who run services across both children and adults. And I think that the answer to that probably also is the answer to what happens if the negotiations leave some roles out of scope. But I don't know whether you've got an answer to that, or whether that's something you might seek people to emphasize the impact of that in their responses. But the sort of differentials, whether it only covers frontline care workers or whether it covers only workers in a particular type of service, or whether it covers I think there is a real concern from employers about those unintended consequences of impact. Great to enhance one set of workers' issues, rights, but what happens to the others?
Yeah, those unintended consequences are definitely something we want to capture through the consultation, because it all helps us to set things up to hopefully address those and mitigate against them in the process. So definitely encourage people to raise those points.
Okay, and perhaps I'll do this final question on scope, and others might come up, but there's a final couple of questions actually. So one is, does it apply to the independent sector, care homes and care agencies? So not just, I presume that's a question of, is it just about local authorities, or is it the whole sector? So I think that's a fairly straightforward answer.
Yes, so the way we've been talking about it isn't about the where you work, it's about what role you work in. So the decision from the negotiating body will be about who this should apply to, rather than where they specifically work. So yes, it will apply to the independent sector, essentially.
Yes.
Short.
And then similarly, a question about personal assistance, supporting those with personal budgets, even if they only do a few hours a day.
Yes, they could be in scope depending on what the negotiating body decides.
So they are in scope in the context of your definition, but not if they're self-employed.
Yes,
so
not if they're
self-employed.
So yes, yeah. Sorry, crucial distinction there. So we set out in the consultation around the fact that we're proposing self-employed workers are not covered by the negotiating body, but personal assistants who are employed by an individual that aren't self-employed, it gets a bit murky, but they could be covered.
Okay, let's move on to money, because there's quite a lot of questions about money, many of which talk about the inadequacy of the 500 million. But there's quite a critical question, which I think is sort of framed as the government's, and I think it's part of your language that you use, Donna talks about this. What does it mean when it says the government is going to contribute to the costs? Shouldn't it be meet the cost of the recommendations if accepted? And I suppose why I think that's important to answer is because I think the government is quite clear, but I'm not sure the consultation makes it clear that the 500 million is for publicly funded social care. So correct me if I'm wrong, but I think that's a really important thing for people to understand, that that money is not intended to cover the costs of enhancement to worker pay for people who for services that are provided to people who fund their own care. I just wonder if I've got that right, and whether actually, so in the context of Donna's question about contribution, I think the government is suggesting that it will, what the money they're putting forward does meet the publicly funded cost of care, or ought to be negotiable within that envelope, but it's not expecting to cover the fact that we have a care workforce that has both people who are paid for by individuals through self-funding arrangements and people paid for by local authorities, but that the fair pay agreement applies to all staff regardless of who they're whether they're working in publicly funded or privately funded services.
Yes, thank you for the question, and thank you, Vic. Apologies, we perhaps should slightly sharpen our language. I appreciate contribute is not as clear as it should be. Essentially what you've set out there, Vic, is correct. So that 500 million is intended to cover the increased costs associated with local authority funded care. The additional costs, so for private funded, we would expect that probably what would happen is that people look to pass that on through higher fee rates to the councils, to individuals who pay for their own care, and to the NHS where it commissions adult social care services. But we recognise that people are going to have lots of views on this. There will be concerns about this. So we really would like to hear any concerns about that people have got to help us inform our work, and so that we can take them into account. And as you say, it's appreciate there's a tension between who we're saying is therefore in scope and who may or may not be funded. We have also published an impact assessment, which Claire may have mentioned. So that sets out our best understanding of some of the potential costs, benefits and risks. So when people are applying to the consultation, you might also want to have a look at the impact assessment and consider that alongside any responses, and it will go into much more detail on some of these points, but I hope that's helpful clarity for right now.
I mean, I think it's probably clarity. I think it probably raises large amounts of concerns for people, and there's lots of commentary from Karen and from various other Mary, various other people about how much money will go out to local authorities, how much of a difference that might make, and of course for some parts of the sector are much more reliant on self-funders than other parts of the sector are, etc., etc. So I think the message is, if people are very concerned about that, then they need to raise that there. But I would also want to suggest I hope it would not be the first time the government has heard that message, that there is lots and lots of concern about that amount of money, alongside the fact that this is a commitment that you've made for 1 year of funding, and there is not an ongoing commitment beyond that that people can look at and see. There is no ongoing. I recognise there's a political ongoing commitment to the fair pay agreement, but not in the tangible notion of some money. Just a final question about money, which is a bit of a question from me. In your overarching commentary about 4 billion going into local authorities in 28-29, and 500 million of that being for the fair pay agreement, we know that probably next week local government allocations, 3-year multi-year allocations, will be handed out. One of the outcomes of that is that one of the intentions of that, as I understand it, is that there will be almost no ring fencing of social care funding. Is this a ring fenced element, or is that in the same way in the pot with everything else?
Also an excellent question. So this is not currently intended to be ring-fenced, and that is because the government is reforming how it does some of its local authority funding and grants, and is trying to move towards a system where local systems have got more flexibility to spend the money as they choose. I recognise there is an obvious tension there with us saying that that's £500 million, but it's not ring-fenced. What would be extremely helpful is if lots of people wrote in their consultation responses that it should be ring-fenced, if that's what you think. The more evidence that we have from the sector about this, the better. But yeah, at the moment, it's not going to be ring-fenced. But please do share all of your views on that with us through the consultation.
Yeah, okay. Very important to do that. So, and Peter's asking, what's the other £3.5 billion for? That, I mean, that's general uplift, I think, around social care to cover costs associated with raises in the national living wage and other things. I don't think I mean, there's a bunch of funds, Peter, like the Better Care Fund and various other things that are wrapped, and that what used to be the market sustainability funding and the adult social care grant that are kind of wrapped up into that, I think. But I imagine there's a breakdown somewhere. Claire or Kate?
We could get a breakdown to share afterwards if that would be helpful, to just show how that's broken down.
Yeah, and some of that is through council tax as well, so that's not central government funding necessarily. So a couple of points about self-funders, and I'm interested, you will come on to the specific questions, but that you have done now 60, nearly 70 of these events, and I think one of the things that have come through for you as a theme is around self-funders, and perhaps I'll pick up the questions in that. So one is that they're not, we have a very, very low threshold in which above which people have to pay for their own care. So it does not mean they are wealthy, and this is going to increase costs for them, and they are already heavily subsidising lots of care through their kind of cross-subsidy kind of arrangements that exist in many organisations. Where is there, what themes have come back to you around that in relation to the sessions that you've done, and where is self-funders' voice in any of this?
Yes, so we've had lots of concerns raised around the potential impact for self-funders, and particularly around the costs and how those might be absorbed by self-funders and the impact that would have on them and the care they access. Linked with that, there have been lots of questions and interest about how self-funders are represented in the process. So within negotiations, what voice will they have? And also the complexity of how you do adequately represent self-funders in such a process, given that it's individuals, and how do you bring that all together, essentially. So that's something we're hearing a lot. It's one of the areas we're looking to focus more engagement on in the new year, about having more discussions directly with self-funders, hearing their concerns, but also we want to hear their suggestions about how they think their voice could be best represented in the process, and how we can factor that in to the negotiating body and process moving forward. So that's sort of the key reflections we've heard. Kate, I don't know if you've got anything different from sessions you've been in.
Yeah, thank you, Claire. I echo a lot of what you've said. They're definitely some of the key concerns that I've heard. Some of the meetings I've been to, people have talked a lot about exactly the point Peter raised in the chat. Appreciate we are not talking about incredibly wealthy people at all here, and we've had some interesting conversations around the potential unintended consequences that might come if that therefore means people delay when in life they seek their care. That's an unintended consequence that people have raised with us, or people like running out of their money sooner. We've also heard interesting unintended consequences around whether people would delay their care, and therefore we would see more people relying on their families, and we'd see a rising unpaid care. So that's not something I had immediately thought of when we were first working on all of this. So a really good example of how people's reflections are really helping us shape our work. The representation piece, we've had a lot of really interesting conversations over the last year or so about all sorts of different forms of representation, employers, local government workers. I think self-funders is one where I feel we have less of the answers than we perhaps do in some of the other spaces, for all the reasons that Claire has set out. it feels really hard to find an appropriate representative voice, and it's, of all the things in the consultation, one of the things where I think we need the most genuine open feedback on suggestions and helping us to get this right. Really open to any ideas now or from anybody else, but recognise that we need to do something, not quite sure what that is, in the same vein as individual employers and personal assistants. Another big challenge for us. How do we get the voice of personal assistants right when they don't have a body in the same way as all the people that CPA, all the people that make up CPA? So lots for us to do. I think there might be all the things that have come up.
Yeah.
I'll stop there in the interest of time.
Yeah, no, I mean, I think it's something that there's a number of comments, that continue that theme, which, really, I mean, I think all sorts of bodies like the Competition and the Markets Authority, some of the previous governments, people at the Heart of Care, there's been a very significant acknowledgement of the kind of cross-subsidy arrangements that self-funders do, and to push more onto them at that point seems an incredibly difficult position. And yes, the unintended consequences around people delaying care. And I think then similarly for organisations, if people delay care, the issues then that arise of sustainability for the broader sector. So I mean, there's lots of concerns around there. And I think the other set of voices not mentioned so much in the chat, but I know that you've been thinking about is people who employ their own staff, so personal budget holders having a stronger voice as well, as a proportion of the sector. There's a couple of points about because we haven't got lots of time left, but about kind of the infrastructure, the architecture that's here already exists. So there's some comments about how do we expect providers to, as employers in this context, to be able to take on board these changes without any additional capacity or resource to do that. So we've kind of glossed over a little bit about the complexities of implementation because we've been so focused on negotiation, but actually, A, it might be about pay, B, it might be about broader issues to do with training, annual leave, whatever. All of these are likely to involve some sort of contractual change. So individual employers having to change contracts with staff members. All of them will have compliance issues, some of them more complicated and more difficult to measure than others. We've got a new compliance agency starting off. You ask questions about compliance in there, but I don't think you ask questions about what is it going to take you as an employer in order to be able to manage within this new environment. And we focus specifically on the FPA here, but of course there's a whole bunch of other stuff that comes with the ERB. But let's just think about the FPA. So that direct question is like, how do you expect anybody to be able to do any of this without resourcing them to do it?
That's a really fair challenge, and thank you everybody in the chat who is raising that. You're right, Vic. We haven't asked a specific question about what that would take for providers. So compliance and enforcement is a work stream that I'm now leading on within our team. We've got a slight luxury in terms of our work in the department that a lot of our work, we had to reach a bit of a position to put it in the consultation. Some things we can afford to take slightly longer on. So we are still going to be doing some work next year on trying to understand what this really looks like for providers. I've been going to a few sessions with groups of providers to ask them those practical questions, essentially help me understand what you as the employer needs to do so that we can start to understand what support you need. I'm going to be trying to do a bit more of that in the new year. So if that's something that people on this call will be interested in doing, I'm very happy to come back and do a session where we talk a bit more specifically about what does this look like on the ground. And then we can talk a little bit about what kinds of guidance and support will be helpful for government to provide. I think that's something I'd really welcome views on from people, because I recognise that it is a gap in our current understanding. What we absolutely don't want to do is introduce something that has really nice intentions for the workforce and put lots of administrative burden on employers and create a whole load of new problems, because that's not very fair. So more work to do in that space, but I'm really open to hearing thoughts on that. I know we don't have a lot of time, but if it is helpful to do a separate session on this at some point, happy to do that.
I mean, I think there's a whole, as I say, there's a whole lot of questions about ERB compliance full stop, and a real concern that the Fair Work Agency's attention will be unfairly perhaps drawn to the care sector. So I'm sure people would welcome that. I guess it's what to what end, and so is there an opening or somewhere within the consultation that you think that there might be a chance to look at that, or you would encourage comments around that?
Yes, in our enforcement chapter, we've got a question that I think says, what support do you need as a provider to help you comply with the outcome of a fair pay agreement? So I think that's probably the question where we would welcome thoughts on this. But as I say, if it's helpful to also have conversations about that, we can do that. But I think there is space in that chapter to put some of these views across.
Great. A consultation that appears in chapters is always something that people will look forward to, I'm sure. Right, not to be glib at all, but there's a couple of questions about the Casey review, and shouldn't any of this implementation be tied up with the Casey review? I know it's something we've raised regularly. Is in essence, is this reshaping the sector and having significant implications? I understand there was a meeting this morning where this is being referred to as the most radical policy that nobody knows about. So it is absolutely, from all the questions that are here, raising concerns about unintended consequences, concerns about how will people comply, concerns about is there enough money? It's who will people be left out? There's loads and loads of stuff that you will have heard from lots of things as well, I'm sure. But how are you keeping Casey Commission involved, and how do we make sure that whatever our ambition is for the reform of social care is enhanced by this rather than undermined?
So just to reassure that we are plugged in with the Casey Commission. So obviously the Commission itself is independent, so there is a degree of separation there. But we have a sponsorship team based within the department, so we talk to them regularly about our engagement and what we're hearing. The plan will be, once the consultation is closed, that we'll be able to feed back what we've heard through the consultation. So the FPA is very much part of the considerations of the Casey Commission, but it is looking at the sector on a wider level in terms of the shorter and longer term reforms that are needed for the sector. And I know that there are lots of plans in terms of how the Commission engages with the sector and hears their views. So an important opportunity for people to feedback about FPA through that route, but also the wider issues and considerations, and particularly things around unintended consequences and the wider landscape for social care at the moment, and how that can be factored in by the Commission. But just to give that reassurance, we are linked with them and making sure that there is alignment.
Okay, two final points, one which I can perhaps answer. So how will the CPA be organised to ensure different parts of the care sector employers are fully represented in the negotiation and one sector doesn't dominate? So I think that's a question that definitely there's some thought in there in the consultation about what representation should look like, but I think that both the department ministers and others, are aware that this is a massive employer sector, very fragmented, very different in terms of size, geography, approach, models of work, and we absolutely need to find some way of representation happening. And there's questions about how that can be meaningfully done. And again, I think it's a resource question about not just supporting setup, but about supporting ongoing engagement, so that, exactly as you described, Phil, we don't get in a situation where one set of interests dominates over others. And the final point I want to raise, and I think you might be able to give a sort of 1 or 2 word answer, but that, which is absolutely not to undermine, it's only come up once in here, but I know it's been dominant in many, many other discussions, is about commissioning and whether commissioning enables this to happen. Never mind ring fence money or non-ring fence money, whether patterns or models of commissioning actually undermine people's ability to deliver both the Fair Pay Agreement and the wider ERB, and what the department is doing, thinking about that.
Yeah, great question again. So this has come up, as you say, Vic, time and time again in some of the other conversations that we've had. Really appreciate and recognise that to get all of this right, you need the systems and the structures around that. You need the commissioning to be right. So there are teams in our department that are doing thinking and work on commissioning. They are intending to do some engagement to really get under the skin of what the problems are. We're talking to them all the time about how these things link across. They've been coming to some of these engagement sessions that we've been doing to hear the feedback from you all directly, and we're sharing all of these insights that we get with that team to influence their work. I think there is even a question in our consultation in the context of enforcement and compliance that asks about commissioning. So there is also space for you to air commissioning concerns through our consultation, but we really hear you and really appreciate that the wider system needs to work for this to work, and it's something we are putting some thought into.
Yeah, and I think just to be clear as well, there's a question about who's commissioning, and therefore, so it's not the money you've talked about is for local government, but health are obviously a key commissioner as well, and patterns of health commissioning may also need to reflect the new responsibilities that the FPA brings. Look, there's lots in there. We're going to take away all the questions. Apologies, I've tried to get to most of those there. I'm aware that there's a couple about different professions and things that I haven't managed to get to, so apologies in advance for that, but we'll try and answer all those. The slides will go up, the recording will go up, and we will have a chance to share that. Thanks very much to Claire and to Kate and to colleagues who've been involved in organising and getting this set up. I strongly encourage everybody to respond to the consultation. There's an open invitation there to invite Kate, Claire and other colleagues to future events, and particularly for those events perhaps in the new year that bring in the voices of people using care and support. There was an earlier question about whether people might feel their voices are not being heard if one consultation is closing sooner than another, and a suggestion you actually extend both to the 6th of March. So I'll leave you with that thought as to whether that's a feasible situation. It strikes me from some of the questions, this is still an area where lots of people don't know enough about the detail and even some of the kind of core elements of it, so that it feels like there's a lot of work to do in terms of making sure it's not the most radical policy that nobody's ever heard of. Make sure it's absolutely the policy that people know what it's going to mean for them and the people that they provide care and support to. So thank you again to colleagues from DHSC and everybody for all your engagement, and look forward to catching up with you again. Thanks. Bye-bye.
Thanks so much,
everyone.
all.